What are the best dynamic stretches for pelvic health? Imagine moving your body in ways that not only feel good but also boost your pelvic health naturally. Today, we're exploring some simple yet effective dynamic stretches that can make a real difference. These movements are active, meaning you don't hold static positions but instead flow through motions that gently open and mobilize your hips and pelvis. They help improve flexibility, increase blood flow, and support your pelvic muscles, which is especially helpful during pregnancy and fertility phases. Let's start with deep squats. Stand with your feet shoulder-width apart, hold onto a sturdy surface for balance, and slowly bend your knees to lower your hips. Keep your feet flat on the ground and your back straight. As you squat, gently rock side to side or pulse up and down. This movement opens your hips, stretches your inner thighs, and gently engages your pelvic floor muscles. It's a great way to prepare your pelvis for childbirth and ease tension. Next, try lunges with a twist. From a standing position, step one foot forward into a lunge, making sure your knee stays over your ankle. Gently rock your hips forward and backward. You can also turn your torso slightly toward the front leg and repeat. This dynamic stretch targets your hip flexors and encourages pelvic mobility, helping your body find better alignment for labor or fertility. Another good move is windshield wiper leg swings. Sit on the floor or on a yoga block with your hands behind you for support. Let your knees fall inward and then swing outward, like windshield wipers. This hip rotation loosens up the pelvic inlet and outlet, increasing your range of motion and reducing tightness in the pelvic muscles. It's especially helpful if you feel tension around your hips or pelvis. Pelvic tilts are simple but effective. On your hands and knees, gently tilt your pelvis by arching your back upward and then dipping it downward. Move slowly and smoothly. This mobilizes your lower back and pelvic floor muscles, helping to improve coordination and strength, which is important for both labor and postpartum recovery. Leaning forward into an inversion can also be beneficial. Kneel on a stable surface like a bed or couch, then lean forward, resting your forearms and head down while keeping your knees close to the edge. This stretch releases tension in the ligaments supporting your uterus and cervix, which can help with discomfort and fetal positioning during pregnancy. Sitting with your soles together and knees bent outward, gently press your knees toward the floor and then releases. This butterfly movement opens your inner thighs and pelvic floor muscles, increasing flexibility and blood flow. It's a gentle way to keep your pelvis mobile and comfortable. Finally, try a child's pose with deep breathing. From your knees, stretch your arms forward and lower your hips back toward your heels. As you breathe in deeply, feel your pelvic floor expand and soften. With each exhale, imagine releasing tension in your hips and pelvis. This calming stretch helps relax your muscles and promotes better circulation. All these dynamic stretches are safe and effective when done with controlled, smooth movements. Remember to listen to your body and avoid any pain or discomfort. Using cushions or supports can make these stretches more comfortable, especially during pregnancy. Always check with your healthcare provider or a pelvic health specialist before starting new exercises to ensure they suit your individual needs. Incorporating these movements regularly can support your pelvic health, improve circulation, and prepare your body for the beautiful journey ahead.